Hello. So this is another one of the resources for the college that I have. I'm going to start by reading it until I can get, a good summary going because it's part of my homework. So this article is titled Sleep, Alcohol, and Alcohol Abuse by Michael V. Vitello. Okay, so abstract. Use and abuse of alcohol is extremely common in many countries. Sometimes alcohol may be used to self-treat insomnia. I've heard that, and I've actually done that before. However, alcohol consumption for any reason will affect an individual sleep quality. The effects of alcohol use and abuse on sleep are complex and interactive. Anyone who consumes alcohol is likely to observe them. Although the particular pattern and severity of the sleep impairment will differ with both the amount and duration of alcohol consumption. The fact that alcohol is a sedative can induce rapid onset of sleep, which may contribute to its use. While the resultation disturbance of nighttime sleep quality and the respiration may possibly result in post-consumption daytime impairment. The persistent sleep disturbance that accompanies both acute and chronic alcohol abstinence syndromes may contribute to the continued craving and urge to resume drinking seen in many chronic alcoholics. So, this is a review broadly examines the interaction of alcohol consumption on sleep disturbance, beginning with a brief overview of normal sleep, examines the effects of modest, accurate alcohol consumptions on sleep, sleepiness, nighttime respirations, cognitive function. It examines the sleep patterns of chronic alcoholics, both while drinking and during acute and chronic alcohol withdrawal. Reviews of what is known as relationship between alcohol use and nighttime respiratory dysfunction, and concludes with some reflections of the implications of this information for drinking practices. So, introduction. As many as 90% of adult Americans drink. Further, up to 50% of men will have at least a temporary alcohol-induced problem at least once in their lifetimes, and approximately 10% of men and 4% of women are likely to manifest a significant and persistent alcohol-related problem sometime in their lifetime. Common wisdom based on alcohol sedative effects leads to its being used to self-medicate for treatment of stress, anxiety, and insomnia. Unfortunately, this common wisdom regarding alcohol's usefulness as an effective sleep quality aid is extremely inaccurate, and the relationship of alcohol and sleep is further complicated when significant alcohol is consumed chronologically or following chronic consumption withdrawn. While the fact that alcohol is a sedative can induce a rapid onset of sleep, it may also contribute to its use. The resultation of alcohol-based disturbance of nighttime sleep quality and respiration can result in post-consumption daytime impairment. Furthermore, the persistent sleep disturbance that accompanies both the acute and chronic abstinence syndrome may well contribute to the continued craving and urge to resume drinking. Seen among chronic alcoholics in addition to the direct disruption effects to sleep of accurate and chronic alcohol consumption and its withdrawal. Alcohol use is also clearly implicated in increased levels of nighttime respiratory dysfunction, daytime drowsiness, and memory impairment. Increased levels of So, just highlighted that real quick. So, normal sleep. In order to understand best the impact alcohol use and abuse can have on sleep quality and related nighttime physiology, it is necessary to understand the typical patterns of periodic alternations among sleep stages and wakefulness that occurs across the night of normal adults. After turning out the lights and following a short delay of 5 to 20 minutes of sleep latency, most people fall asleep and demonstrate a rather consistent pattern of sleeping across the nighttime hours. Sleep is characterized by systematic variations in the electroencephalogram, which is EEG, electroechocardiogram, and electromyogram. It is mostly broad divided into REM, which is sleep accompanied by rapid eye movements, and non-REM sleep. REM sleep, in addition to its characteristic rapid eye movements quality, is typically associated with dreaming and near complete loss of voluntary muscle tone. In an EEG pattern that resembles the alert waking state, despite behavioral and non-responsiveness. Non-REM sleep is divided into 4 stages of depth. So you have your stage 1 is light sleep, and stage 4, the sleep is the deepest stage. The progressive change in non-REM sleep stages is also characterized by a progressive decline in EMG quantity muscle tone. Depth of sleep can be operationalized as difficult in awakening and auditory stimuli. During the first 60 to 90 minutes after sleep onset, an individual moves progressively through the non-REM sleep stages, from light to deep sleep. This progression is followed by a period of REM sleep. Similar sleep cycles occur repetitively throughout the night, usually every 60 to 190 minutes. As the night progresses, each cycle is less likely to contain stages 3 and 4 sleep, collectively referred to as slow wave sleep, and more likely to contain longer periods or bouts of REM sleep. A healthy, normal subject in their 20s will typically have a short sleep latency, a high sleep efficiency of time spent asleep as a function of time spent in bed. Approximately 95% and who will spend around 25% of their sleep time in SWS, which is your slow wave sleep, and 25 in REM across approximately 5 sleep cycles. A healthy, young, normal person will also typically exhibit few interruptions of sleep by nighttime wakefulness and relatively smooth progression of sleep stage shifts from one stage to the next. Not rapidly and repeatedly flipping back and forth among stages. Deviation from this idealized sleep pattern can occur in the presence of erogenous stimuli. This advanced age in response to a wide variety of sleep disorders and in response to ingestion of drugs, such as alcohol or withdrawal. So acute alcohol use, sleeplessness, and cognitive functions. This normal sleep pattern is changed markedly in normal alcohol-naive subjects following acute alcohol ingestion. While the specific effects of alcohol and sleep patterns are dependent upon the amount consumed, time between consumption, and actual blood alcohol concentration, achieved a number of generalizations about acute alcohol effects have been made. First, and not surprisingly, given that alcohol is a sedative, results in feelings of fatigue and tiredness that decrease sleep latency. Secondly, acute doses of alcohol result in increased time spent in slow wave sleep in the first half hour of the night. Thirdly, the amount of time spent in REM sleep in the first half hour of the night is decreased significantly. In the first half of the night, not first half hour, first half of the night. Even in response to relatively low alcohol doses, equivalent to 2 or 3 drinks within an hour of bed. Fortunately, the amount of time spent in REM sleep in the second half of the night is increased. Fifthly, even modest doses of alcohol produce significant increases in sleep stages shifts and nighttime wakefulness. specifically in the second half of the night. Sixthly, the modest doses of alcohol can result in a significant increase in sleep-related respiratory disturbances. Finally, sleep can also be disrupted by the gaseous esophageal reflux and polaroid that alcohol consumption may often cause. The occasional drinker who consumes half a bottle of wine or so at a late night dinner would be likely to experience all of these effects to a greater or lesser degree. So, while on one hand they could anticipate falling asleep more rapidly than normal and experience very sound sleep for the first half of the night, the second half of the night will most probably be characterized by considerable fragmentation of sleep, by intervening bouts of wakefulness and sleep stage shifts, and an increased number of vividness of dreams. So, it is also possible that this occasional drinker nighttime respiratory could be compromised by the modest pre-bedtime alcohol consumption, particularly if they typically snore or have mid-level of sleep-related hypopnea or apnea. These related breathing disturbances can themselves result in the periodic significant dips in blood oxygen saturation and additional sleep fragmentation. These disturbances, sleep and nighttime respiratory patterns, probably account for some of the morning grogginess, fatigue, and lack of sense of morning refreshness that often follow acute drinking bouts by relatively alcohol-naive individuals. It is also extremely important to consider the regard to bedtime alcohol consumption, but also in the context of alcohol's effect on sleeplessness across 24 hours. Here we focus specifically on the sleep-inductive effects of alcohol, its ability to produce a sense of sleeplessness and bring on rapid sleep onset. The sedative effects of acute alcohol ingestion, regardless of the timing of its consumption, are not the result of the actions of the alcohol alone, but rather the result of direct effect of alcohol's unmasking of an individual's sleep debt, and the timing of the alcohol consumption relative to the individual's circadian sleep tendencies. Under normal conditions, an individual's sleep tendencies varies across 24 hours, being slowest shortly after waking and in the early evening, and highest during the night, with a secondary dip in arousal in the mid to late afternoon. Not only does alcohol affect sleep, but sleep can affect the sedative actions of alcohol. A given dose of alcohol sedative action are subject to individuals' differences. That is, some individuals tend to be more psychologically alert or less sleepy than others across their circadian day. Further, a given dose of alcohol sedative actions can be enhanced by consumption timed with maximal normal circadian sleep tendencies or in the presence of a greater than normal sleep debt, and attenuated by sleep extensions, and inferentially by timing with minimal circadian sleep tendency. Finally, it needs to be pointed out that these complex interactions between alcohol ingestion and sleep have direct implications for alcohol's effects on cognitive performance. Not surprisingly, cognitive function, as assessed by divided attention and vigilance, tasks are affected by this subtle interweaving of alcohol and sleep effects. Put simply, sleep need and alcohol consumption interact to produce sleeplessness and resultation cognitive impairment. This means that alcohol consumption, regardless of its timing, may interact with sleep debt, circadian timing of sleepiness, and the presence of other sedative drugs to produce sedation and potential impairments in cognitive performances, an increased likelihood of accidents even at relatively low doses where there may not be frank intoxication or significant BACs. Whew. That was long-winded. Not going to go into a detailed. I just wanted to read the first 3 pages of that, and it kind of gives you a sense of what it's about. It's about the relationship between sleep, alcohol, and alcohol abuse, and how. So, I might just read the conclusion. So, in the conclusion, common wisdom based on alcohol sedative effects leads us often being used to self-medicate for stress, anxiety, and insomnia. Unfortunately, this common wisdom regarding alcohol's usefulness as an effective sleep aid is inaccurate. Rather than enhancing sleep quality, here we go. Alcohol ingestion results in significant sleep disturbance, particularly in the second half of the night. While alcohol induces rapid onset of sleep, the resultation alcohol-based disturbance of nighttime sleep quality and respiration results in post-consumption daytime sleepiness and functional impairment. These disruptions in sleep, nighttime respirations, and daytime functions persist in the face of chronic alcohol use. Chronic alcohol use is as likely to result in significant increases in nighttime respiratory dysfunction with its association of increased cardiovascular and cerebral vascular illness risk. Furthermore, the persistent sleep disturbance that accompanies both the acute and chronic absence syndromes may well contribute to the continued craving and urge to resume drinking seen among chronic alcoholics. All these factors mitigate strongly against the use of alcohol as a sleep aid and suggest that those at increased risk for developing sleep-related breathing disorders such as older individuals, obese individuals, or chronic snorers should be especially circumspect in their alcohol consumptions, particularly in the evening. So, that's it for that article. Thanks for watching.